We are an all Colorado company. We are 100% organic. We are, all processed and manufactured in Colorado as well. We chose Colorado for some very specific reasons. We really, chose it for a couple different specific reasons on the grow and environment standpoint because, the rich agricultural aspect, the nutrients that were in the soil and in the air being so clean, the water sources that we've had the ability to tap into being natural and all clean and coming from the right environments. But we also grow at 73 to 7,500 feet in the air. We get a lot of that UVA and UVB light that really makes our CBD oil as potent and effective as possible. We're gluten free, we're non-GMO, we're vegan, we're solventless. We do full spectrum and broad spectrum products, which we'll highlight a little bit more. We don't have to bury too much into that, but we have no fillers, byproducts, and chemicals in our formulations and products. And we use a unique method of extraction called the RSO method, where we're doing cold press ethanol soak extraction, where we're not using CO2, which is really that chemical approach with cold pressure, heat, liquid to gas, and that CO2 all creating a very, very volatile and very rough process where we want to be really careful with this oil, these products that we're developing, because they do have very sensitive points where that evaporation can happen and damage can happen based on these extraction methods. So you want to be very careful in how you do these things, and we do that at Imbue. We have technical and cutting edge methods. We're also controlling the process from seed to shelf. So when we work with partners like you, Brad, and the other pharmacies and compounding pharmacies and doctors and practitioners around the country, they're very comfortable in knowing that we're controlling the process and the chain of custody. And that's important to all of your customers and our customers, anyone who's listening in, and knowing what to look for is really wanting a very extensive C of A list behind it, which is a certificate of analysis. That's important, and being able to point to that for your customers and being able to highlight that as a brand, because we are very transparent. You can look under our hood and we're okay with showing you everything. So we're doing a very extensive C of A list, which is really highlighting tissue and soil samples right at the farm, all the way down to testing the product at the end, which everything in between is the important stuff, where we're doing microbial, residual, potency, full spectrum testing. We are doing arsenics, metals, and many more things that are attributed to those C of A's that when we activate them. So we are doing this all for the safety and protection of our partners and our customers. And we want to make sure that they are getting the best quality products on a daily and monthly, weekly basis. And we're always developing new products and new techniques as we move on. I highlight this page to start with, just so the viewers and anyone else listening in can see what we focus on from a standpoint from the beginning, and then out at the end when you get the products actually in your hand and you start using them. But I think it's important to highlight this is what the company actually represents, what we continue to do in the market, and always supporting our customers. We offer probably one of the most extensive lines as well. As you know, Brad, you carry, I think, pretty much every product we have. From soup to nuts, we do tinctures, we do capsules, and a variety of them. And we could touch back on this with any questions about milligrams and which products are potentially right for some of the customers or listeners. But just going through what this lineup is before we get to the main topic of the evening. We do broad spectrum products as well, as I mentioned, where we're removing the THC. So knowing the difference between what full spectrum is and broad spectrum. Full spectrum is where we have all of the cannabinoid profiles and all of the nutrients and active ingredients and terpene profiles sitting within our oil. We are doing the same thing with broad spectrum, but the difference is that we're removing the 4 THC components out of these products, where we're removing delta 8, delta 9, THCA, THCV. And we're now creating a true zero THC free product that allows for a great representation of what we have up on screen, where police, military, or fire, or athletes, or pilots, or even zero tolerance human resource departments of certain jobs that are out there that do not have a tolerance for THC, a trace amount being in those products. They're available in a capsule and a tincture, which is most important because of the ingestible aspect. We do offer a line of gummies as well, all organic, tapioca-based, natural gummies with all natural flavor profiles and terpenes. Just a wonderful lineup here, and a variety of choices, whether it be bag or 30-count jars. We are also doing a complete line of topicals, as you know, lotions in small and large sizes, the medium level salve in small and large. We do lip balms, and then we do a high level imbued black salve, which is a higher milligram, higher concentrate in a small and medium, or a small and large as well. And then we have a whole line of beauty products that we're very happy about, very successful with, that you offer as well. And we did the beauty cream, face cream that sits in the middle. We won 2019 Men's Health Magazine CBD Face Cream of the Year with that product, which we're very excited about. We have massage oils, and then we have a whole line of pet products that are for canine, feline, and then we also offer products for equine, and now we've released a new product for cattle, which is a salve, just like we're doing for the equine. And we continue to go at the market that way. Before we go back to some of these educational pieces, which we'll touch on, I want to go to the main page here where we can both talk together on this, Brad, because you at your pharmacies every day are focused on not just filling prescriptions. You are there as a trusted community member, owning and operating these 4 pharmacies and providing health and wellness. You're doing it from supplements to household products that they may need, suggestions of the proper diet and other things that go along with owning a community pharmacy. And health and wellness is your profession, and it's what you're doing day in and day out. So by bringing CBD in as a product for your environment, it's another tool in your tool belt, and it allows you to expand on what you're telling your customers every single day. And it's another way for them to add in a product that is definitely when you take the right one, a very organic, holistic approach. When you understand what CBD does, and how it can help balance out your body. And some of those things that you're seeing are probably pretty exciting from a standpoint of results, I would think.
It is. And, just to be politically correct here, I think it would be worth our while to both mention that, we're not intending to diagnose or treat any particular condition we're going to talk about tonight. What we're going to give you is feedback that we've seen that come from real patients and other colleagues in the industry. So, I would encourage you, if you have a medical problem, you need to talk to your medical provider. And, if they have questions, I'd be happy to be a resource, and I'm sure that Chris could help me if I need additional information to solve that problem. But yeah, especially during COVID-19, this has become a situation in the pharmacy environment where even there was a time in our pharmacies at the medicine center where our doors were closed to walk-in traffic, we were still open through our drive-up windows and our curbside service and our phone calls and our website. And we were triaging a lot of patients that had questions. I mean, a lot of doctors' offices either were shut down because of personal protective equipment limitations, or out of fear and trying to figure out how to deal with treating patients in a closed quarters environment. So all those questions came to us at the pharmacy. We're totally used to getting questions about, what's this spot I have on my elbow, or some other scary place on your body when it comes to poison ivy or poison sumac or bug
Yeah.
bites, but it's so it's something that if I can give you an option that isn't a prescription drug or a medical procedure in theory to help you try to solve your problem, I think a non drug solution or a healthy foundational solution is a good one. So, whether it be a supplement, whether it be yoga or meditation, there's a number of different things that we can talk about from a variety of different issues that you may be struggling with. But CBD has been a tool that has been really impressive with respect to just additional options and support it can give. And I'm sure we'll get into this deeper a little bit later, but I can't get over how many people come in for CBD for their pets, whether it be for storm issues or anxiety or things of that nature. But pets is probably our most requested reason for CBD in the pharmacies of late. And so it's been really interesting to talk to other pet owners about what their challenges are and what they've seen as a result of those therapies that they've started.
Yes, 100%. And you bring up a good point. When we always talk about CBD, we don't ever say this is going to medically cure you or this is the answer to all your problems. And we always say that with specific ailments or medications that you might be on because of a specific ailment, that you do consult your doctor and you do tell them that this is a product that you are interested in doing, and adding into your daily regimen. And there's good reason for it. There's good reason for it because this is a world that has obviously been now in our lives of 5 to 7 years of excitement and still growing each and every year thereafter that 5 year mark. And it continues to get more and more exciting because of the more and more research and clinical studies and documentation that is around it from a medical approach. The reality is that CBD has the ability to provide support, alleviate, provide relief in so many different categories for so many different things that we face. So, as kind of a build up to the idea of overall health and wellness, we face so many different things as individuals. It could be there could be anxiety and sleep disorders and depression and stress and pain management and serious autoimmune concerns, and there's Parkinson's and Alzheimer's, and there's all of these different things that an individual can face, and then on top of it we all have our different levels of what those ailments are, and it kind of starts you back at that ground zero point of how CBD can actually benefit an individual and how it can help with balancing out the receptors that are within our body. And I think it's important because even this page, and we're not going to touch on every specific word on this page, but these are the variety of CBD choices that are in the market, whether it be full spectrum, broad spectrum, or isolates that are out there. They all have a purpose. They all provide support when they're developed properly. And you can kind of look at CBD as kind of breaking it down to simple terms as that multivitamin when you talk about full spectrum CBD. It's that multi receptor, multi reactor to a system that, quite frankly, is your largest receptor group in your body. That's called your endocannabinoid system. And how these products make a connection to that system is super important in understanding the process in which they're, like we touched on earlier, the extractions, the formulations, the formulas that are put together to provide support to our bodies. And this says, going back to what I said earlier about CBD, is not created equal, and it's not one size fits all. And this is your receptor system here that is so important in how CBD connects to this. And full spectrum CBD is going to give you that best connection. Imbue Botanicals provides a true full spectrum product where we have all of those cannabinoid profiles. We have all of those terpene profiles, those natural nutrients and active ingredients that we're extracting from the hemp plant, because we want to make sure that this connection truly happens, because you will not generate what they call the entourage effect, where all of these receptors are working together and balancing out together, if you don't have that. And that's not necessarily to say that when I talk about the other types of products that are out in the market can't provide some support, but to get the true support that you're looking for, this is what we want to happen. We want your nervous system responding. We want your peripheral organs responding, all of those different things firing in all cylinders to bring balance to these different receptor groups. And full spectrum is going to provide that overall support. Why this is important is because knowing that we are all different, where are we deficient, right? Where are we lacking in certain things? This allows, um, as an owner, as an educator, as a student myself of an industry that is ever changing and ever growing, and then to work with providers like yourself and so many others in the medical space to be able to talk about these types of things, how certain products can affect them, how you can create a real health program for them, so that we talk about why certain things might not work the way that they should. Where, are you having the right diet, Brad, where these products are going to actually perform better in your system? How you metabolize that diet that you're currently on. Certain things like, how are your supplements that you're currently taking? Are you taking vitamin D and vitamin C, and vitamin D being a huge catalyst to having CBD perform properly? All of these things play a key role in the benefits and effects, to where you can actually turn to somebody and say, hey, you know what? I started taking CBD from XYZ, a couple months back, and it has really helped me with my anxiety, or it's really helped me with my pain management or my sleep, and so on. So it becomes a lifestyle, rather than the idea of taking aspirin when you have a headache. It's becoming part of that program. And when you look at the many receptor groups that sit below it, and it even expands beyond this, but this is probably the greatest 101 for it, the sub-receptor groups that this endocannabinoid system is all connected to, CB1, CB2, and now they're really working on the benefits of the CB3 receptor group. And it continues to grow and expand on what the benefits of CBD are. So when we talk about these different profiles, because everyone always wants to know, because they're always associated with this biggest piece of pie, right? They're always saying, oh, CBD is everything. CBD has become the recognizable term for what the rest of all of this is above it. These individual pieces of the pie, they provide tremendous amount of benefit and support on their own individually. And that's why the world of isolates play a role, right? There is benefit in isolates, because when we talk about the industry and we talk about where it's starting to go and how much they're starting to uncover about the importance of CBG or the importance of CBN, and also, CBC and so on, is that we have deficiencies. We do have cannabinoid deficiencies in our body. Where can I gain benefit from beyond just taking a full spectrum product, which is a great baseline, Brad? But where can I take it? Where can I take it to the next level? And learning about, is it proper for me because of a specific type of diet and program that I have, or deficiencies that I may have, that I need to bump up my CBG intake to have full spectrum CBD perform at a higher level. And it is very relevant. It's very true. And it's starting to become very much more aware, because you're starting to see these other profiles as isolates on the shelves. And I don't mean isolate specifically the powder driven way, where isolate typically is attributed to a powdered form of these cannabinoids that we have represented, but it's now really extracting them out as single compounds, single profiles, and providing them as opportunity to increase those levels because of what each one of them do. And now saying, well, you know what? I really don't have some of the things that are under the category of CBD, but CBG and CBN really look like they're the right fit for me, and they can bump up in those areas. So it's changing. The industry is exciting, and at Imbue, we pay very close attention to this and what our forward footprint looks like and what we want to do in the industry. So all I can say at this moment is we have some exciting things that we're developing, where we're going to be able to bring them to our partners in the very near future, and continue to evolve and provide more and more options, for our customers, our partners, our patients, that we're helping on a daily basis because of the relevance of each one of these profiles. Now, to go back to these slides, I put these slides in because they show the importance of talking about that overall health and wellness. I'm sure, on a daily basis, Brad, when you do a consultation to one of your customers, patients, you talk about these things, and it can be as simple as changing the way you breathe and relieving stress, right, to make an impact on your health. And we don't always take our own, the advice from ourselves, right? So it makes healthcare individually that much harder. But when we have somebody that we trust, like you, tell them that, hey, get outside and walk for 15, 20 minutes a day, right? Don't eat sugar constantly, and don't eat steak every meal because it can have a negative impact on your body's health. We're all allowed to indulge in certain things, right? Our bodies are built for moderation. They're not built for sprints, right? We're trying to build for the long road, the marathon. We're not doing sprints here. So that's why it's important to really start to become, from our industry 100%, and we share in that care with you of being a health coach and giving our customers, patients, that opportunity to really understand the differences in how they approach their daily activities. And that's why these are here, and even showing some of the supplements. I mean, how many supplement conversations do you have a day on what they can take?
Quite a few.
Yeah.
Quite a few. And it depends too, because it's exciting because between different nutrient depletions that can be caused by a particular disease state or even a drug therapy, there's a lot of opportunities to dial in. I mean, it's a little off our topic tonight, but over the weekend, I was reviewing one of my genetic tests that I had done that showed what I have a disposition to with respect to metabolizing certain vitamins from their inactive to active forms. So you may have the perfect diet and the perfect health, but you might not be able to metabolize folic acid into its activated form. So that's something for another day, but
No,
it's just something to think about. Your body's genetics are your body's genetics. You got the hand you were dealt, so all you can do is work with it.
yeah, that's extremely important what you just said. And there's tests out there now in our space. We partnered with somebody a few years back, and we could talk more about that offline. That you are able to provide that to your patients, your customers, about that test, because the same deficiencies in vitamins and supplements are the same in the cannabis space of these profiles. And where those multivitamin slash individual vitamin approaches really now take form, and how it becomes a program, and why you can bump things up versus or even remove, and that's important. So we could definitely expand on that. We can even do a whole webinar on that, about just your overall diet, because it's really important to creating the right program for yourself. Because when you prescribe a drug, a medicine, or tell somebody about an OTC, there's a conversation that happens with it regardless about, take this, 2 times a day, or take it with food, don't drive, don't, there's a program and there's side effects and there's this whole thing that happens with a prescription. OTCs, there's a conversation that happens with it as well, because how an OTC may interact with a prescription and which is the right amount of milligrams. And there's all these things that happen. The world of CBD is no different, and the world of LDN is no different. And the interesting part about the world of CBD and LDN is that there is no magic bullet, right? There is a feel process. There is a sweet spot. You have to work at finding that sweet spot. Um, just because you and I may have the same exact thing that's going on doesn't mean that you and I both need to be on the 25 milligram capsule to get the effects that we need. I may need to take the 10, you may need to take the 25, or vice versa. It's what our bodies are going to accept, react properly to, and then generate the reaction and the benefit from it. So there is that feel process. So when somebody does walk through the door and they're like, well, I heard about, CBD is this unbelievable stuff and it could do all these great things for me, but I do have one specific thing that I want to help, and it's anxiety, and I want to get better with it. What's your highest strength? It's not that. It's,
Yeah.
hey, let's talk about it for a minute. Let me understand what's going on a little bit. Let me direct you properly so that actually we can start you on something where that you are going to come back and continue this program. Because if you take it and you go home and you take 10 of them, for the next 10 days, and you're like, well, this isn't working right. And then I'm never taking this again. It
Well,
happens a lot.
yeah, and you could probably comment a little bit more on that as we get down the road here, but that's I'm kind of finding with a number of things, and it actually, ironically, it applies with low dose naltrexone too. But if you're on a therapy and you're getting zero benefit, it's my inclination that there's one of two things happening, maybe both. You're either on the wrong dose, or you haven't been using it long enough to give your body time to adjust.
It's both.
And frankly, I guess generally when people come to us at the pharmacy and have questions, sometimes we're the first stop, but sometimes it's because they've been to 3 or 4 doctors and tried 3 or 4 or 5 or 10 drugs and are frustrated, and they've got 3 or 4 or 5 different conditions. So they've got all these things that have built up on top of each other, and it's not going to be an overnight fix. So I personally am a very impatient person and certainly want quick results. But sometimes it's like you said, it's the marathon, not a sprint, and
Yeah.
we got to be mindful of the fact that you might get a little bit of results in 14 to 21 to 30 days and a whole lot of results in 3 to 6 months. Not too many people want to wait 6 months, but sometimes, would you like to feel better in 6 months from now than you do now? I'm thinking most people would. You want it faster, but
You want to feel immediate relief, and if you feel the immediate relief, you'll put in more of the effort for the long haul, because that's typically the way that we work. Like how you said, we're impatient. Sometimes they can get that real quick flash in the pan where they're like, wow, and then they'll put in that effort, and we all know that's exciting when something works right away. The other part about the process, which is, it's tough, is when you are already on a few things, or you're already seeing multiple doctors for certain things, and you're on a cocktail, if you will, and your receptors, we all know how medicine works, jump, leapfrog, smash down other receptors to get to the receptor that you need to calm down, but there goes the rest. There creates the side effects path of what other things can happen to you. And the more imbalanced you become, right, the more that line becomes skewed. And I used to use the analogy of Back to the Future, the movie, where when he goes into the alternate 1985 timeline, and it's because you've now adjusted so much that you have to fight that much harder to get back to that clean slate mark, which never is going to happen. But how can I get back to quality of life, right? How can I get back to a point where when I wake up in the morning, it's not so difficult. Or when I go to bed at night, I feel comfortable that I know that I'm going to get some time with my eyes closed and my mind calming down and relaxed. Or I don't wake up with those same creaks and cracks. And it's going to be a tougher fight the more imbalance is there. But what CBD will do and work very hard at, specifically full spectrum, is it not only works on the receptors that are the most imbalanced, meaning the ailment parts that you're really focused on, but it's working with all the other guys. It's working with all the other guys saying, hey, these guys need help. We need to pick them up and carry them over the line, not just let him struggle on his own to get there. Let's work as a team. And that's how the full spectrum approach is, rather than the individual go. And not that, CBD itself, CBD profile, the cannabinoid, profile there is working extremely hard on its own. It's got a lot of benefit to it, you know, but all of the other guys are so important in getting there. And you'll see, just like when we have our LDN discussions, right? LDN is one of the most unique things that I've seen in the pharmaceutical space, compounding pharmacy space, is that it's working on a lot of other things besides just that one main ailment, whether it be focused on inflammation or Hashimoto's, or it's working on opioid abuse or something else that people are doing. It's also performing really well in other areas. Different receptor group approach, but still working wonderfully. So when we do have our LDN CBD discussion, which we'll put together, they work extremely well in combination. They're very supportive to one another, and it's an excellent way to maybe, knock a few of those medicines that you might be taking, off the list with that kind of
Definitely.
potential. So here's a page, and we don't have to focus on this too crazily. I always bring this up. It's an exciting page for me in the CBD space, in the full spectrum space, just because of the benefits that terpenes provide and how they support a full spectrum CBD. They carry a tremendous amount of benefit when they're there in the original state without having to kind of reconstitute them and put them back into a product. They're always going to work best, right? It's always at the original level, the original state. Everything will perform the best. If you try to manufacture it into a product, it's going to underperform. So we have the true natural terpenes that are in our oil because we do the RSO method. And that allows us to truly get the benefits from these 8 categories here and really perform at a high level. Terpenes are not just the aromas, which we are so familiar with in the world of botanicals and fruits and plants and so on. But there is so much more below each and every one of those terpene profiles that provide health benefit. In the world of that we're most commonly associated with, the world of whether it be lavender or sage or turmeric and ginger and all those great things provide a lot of health benefit in the supplement space, or arnica flower and mint and rosemary, whatever it may be. The terpene profiles here in the hemp plant carry a tremendous amount as well. So we want to make sure they're here. We know that they're working. We know that they're doing their jobs and making our products that much more effective. Beyond that, one of the things, Brad, that you've probably relied on and your staff has relied on is the education program that we bring. We don't just train and do seminars and do webinars and go to conventions and talk the talk. What we're doing is we're providing a program, and that program consists of training materials, in-store guides that you can point to, dosing charts, and other materials that support the things that we discussed this evening, that answer questions that your customers have on a daily basis, increase that level of trust that you're already providing so that you can actually point to something and show them, rather than just make it sound like you're just telling them because you're telling them something. There's actual data behind it. And I think that's always important in the pharmacy space, because you brought up a point before about doctors, and there could be 4 doctors that they're talking to and seeing. And you're right. I feel like they always come back to their pharmacist, because their pharmacist will take the moment to step out, have a conversation with them, and give them an honest opinion and an honest thought process around some of these things. And we'll be honest with, their experiences also, even with a drug, that if you might not be comfortable with it, you know, I think that bears tremendous amount of respect, and very, very trustworthy, that you are in a space that provides that kind of level of care.
It can be very rewarding. So it is nice to be able to have that consistency. Sometimes it's frustrating too when you're working to provide education and it's difficult to translate. So I think that when we take time out like this session tonight to talk about some basics, on a daily basis we get questions in the pharmacy. I heard about CBD. I what is it? How does it? People don't know if it's a liquid or a capsule or an ointment. So, and it has different applications depending on which type of condition you're trying to get some support in. So, I think it's nice to be able to have some flexibility with that regard. Um, and I think that one of the most common questions we get is how do I start? So, do you want to comment on what your most recent experience has been, and then I can comment on based on some feedback and some sharing that I've had recently, and maybe we can address a couple basic questions before we, wrap up here tonight.
Yeah, sure. I think from a starting point, there are some simple questions and rule of thumb that you can kind of follow as a provider by, first understanding the ailment, understanding the severity, learning a little bit more about, someone's, daily life and diet and activity, that you can take a pretty good assessment just overall. And I think probably just good questions in general, so that you can really make a connection to that person and start the process. But goes back to a lot what I said earlier about, it's not just about, every person that walks in the door and giving them the highest level milligram just because that's what they think they need. Um, so a lot of it, can be described around, severity of the ailment, right? What's your level of pain or discomfort, or, what's your level of anxiety or sleep disorder or depression, or whatever it may be, that you're trying to understand why they're even, thinking about CBD, right? Because it's a good choice. We talk a lot about maintenance, right? With CBD, and it's a good choice just for you to take CBD as a maintenance thing. Just for overall body balance and maintenance, of whether it be so that you don't face something that could be terrible at a high level, right? So that you're creating, a good fortress against certain things. Um, it's good for recovery with working out, or doing hard labor and exercise on your body, because of that inflammation and calming the body down. There are, different approaches, from is it chronic versus onset, and that's why we offer different products as well, whether it be a tincture, a gummy, or a capsule. CBD, has a half-life of 24 to 48 hours. And within that, there's an effectiveness rate of how these products perform depending on which style of product you are taking. Then on top of that, based on your body and your metabolism and when you take it versus, taking it on an empty stomach or when you eat, and we suggest taking it, after, while you're eating, because you're going to get the benefit of the proper absorption, and then also the reaction from the natural, whether it be, fatty acids, lipids, and things and nutrients that is in the food, that is going to react well with the CBD to actually perform better. And there's an effectiveness rate along those lines of the products you're taking. So, for instance, chronic pain and issues, we always lean towards the capsules. because you're going to get a little bit longer time for it to kick in and start generating, but the effectiveness rate in your body, it's just more sustainable because of how it processes through your gut and then how it's, out through your liver. So we are creating a a formulation, and we're using an all natural vegan capsule that as soon as it hits your stomach, it's gone. So it's not a gel cap. Gel caps aren't vegan anyway. So, but just things like that alone, right? Our tinctures are all natural. It's a vegetable glycerin. It's an all natural pygmy palm fruit vegetable glycerin, and it is extremely well received within the body and bioavailability for absorption and reaction. So it kicks off quickly, but it's not going to last as long as the capsule. But we're getting a great reaction to that product. It's water based, so it's making the right connection. And there's different levels and strengths of that as well. And what we do is when we start to talk about these conversations of severity and what's the issue and chronic versus onset, sometimes we find ourselves going middle of the road a lot, unless it's always at the highest level, you will throw the book at it a little bit more just because of it, where you might find like someone who has fibromyalgia or an autoimmune disorder that's at a very high level. And there's many other things, but you might just immediately go to it because you want to kickstart and generate a quickest reaction, right? The quickest benefit. But we find a lot of times middle of the road works extremely well with a 10 milligram capsule, or doing the 250 milligram elevated tincture is a really nice sweet spot for starting to find out what the right path is for the customer patient. And there are some dosing protocols around it. Is it going to be once a day or is it going to be twice a day? Well, feel it out. See what might work best for you. It could be in the morning and at night, or it could just be at night before you go to sleep. Or the tincture gives you versatility to potentially do half in the morning and half at night, or titrating up and titrating down. You have that ability, and that's why we also provide you guys with those lovely dosing charts to rely on and get some of that, that understanding. Because once you start to really, connect to this type of approach, it becomes really natural in how you have those discussions.
Well, and one of the things that's really nice about the tinctures in particular is your flexibility in dosing. So we mentioned earlier that it's very much an exercise in trial and error. Sometimes, if let's talk about, had somebody in last week I talked to about having trouble sleeping, and they wondered if CBD might be a solution for sleeping.
Yep.
So usually for someone who wants to see if it can help them relax and fall asleep, I usually go with a tincture. And depending on what the person's background tells me, what they're dealing with, what their situation is, what their stress level is, I'll usually make a recommendation, kind of like you just mentioned, maybe middle of the road. But the great thing about a tincture is you can increase it or decrease it by quarters of a dropper or a half a dropper. So, let's say tonight you want to see if CBD can help you get some rest. I usually say about a half an hour before you go to bed.
Yep.
Try a half a dropper full. If you get nothing, well, then maybe tomorrow night you try 3/4, or you bump it a little bit.
Play with it.
I mean, and you have that flexibility. So, that's something that's really nice, because you bought this bottle. You're not stuck with one dose like you would be with, you mentioned aspirin earlier. Maybe that's not the best example, but you buy 500 milligram aspirin, you've got 500 milligram aspirin. What are you going to do? You're going to take 1,000? I mean, that's a big jump, 500 to 1,000. Whereas when you can titrate your tincture, it's
Headache.
more of an incremental dose, and you don't have to worry about taking too much of a dose on CBD. You're not going to make yourself intoxicated. You're not going to make yourself groggy the next morning. So it's, you can work with our pharmacist at the medicine center, and if we have questions, we have colleagues in the industry we can reach out to, like Chris and other pharmacists. And one of the great things is you're not alone in trying to find a solution to your problem. you can be confident that if you have a solution you're trying to address, you're probably not the only person. You know, millions of people in this country have chronic pain. They have arthritis. They have fibromyalgia. They have inflammatory diseases. And what is worse than pain? And everybody's concerned about taking opioids or narcotics now. With the anti-inflammatory properties of CBD, might be a solution that can help take the edge off for you. Again,
Right.
it's another discussion, but and so it's something just to keep in mind. So
I totally agree. I mean, you when you look at also CBD from also, because we get a lot of those questions about ingestibles and topicals. We have always found that number one, when you use things in conjunction with each other in the CBD space, topical and ingestible, when it is something specific to, whether it be pain management with muscles, knees, joints, pains, whatever, things like that, even neuropathy, or even something from a skin ailment that you might be facing, using in conjunction has worked wonderfully, because a lot of those things that I just mentioned are tied to inflammation. 80%, I think, of what can actually happen can start from with inflammation. So it's a great let's call it additive as well, not just potential replacement. It can be an additive to the things that you are already taking to generate a better benefit, a bigger benefit. It's a unique, I think, a unique space, um, from its capability standpoint. I think we are just scratching the surface still, even though there's been so much talked about and studied on, and trial and error, and testimonials and information behind things. It's still growing and evolving, and it's only going to get better. But I definitely think that whether it's something small, medium, or large that we face, because we all deal with something in different sizes and different ailments and concerns, that it is something to look into, as a healthy additive to what you are currently doing with your lifestyle, for sure.
all right. I had one question come in if you want to address it, and then we can wrap up.
Sure.
I had someone ask me about the endocannabinoid system, and how is it that we haven't known about this until
All of a
somewhat
sudden,
recently?
all of a sudden, it mysteriously appeared.
It's an excellent question.
Yeah. Um, the real truth behind that is actually it's been discovered a very long time ago, um, because, and I want to very carefully use my words here, but because of what has, been restricted in the cannabis space, and the health benefits behind it, um, and the freedoms that have kind of presented themselves, years ago, starting with, I'm going to call it, cannabis marijuana. Um, it became more aware, more visible, if you will, because it started to really take shape again around some of the similar things of why cannabis was first introduced in the 1800s, and using that around, pain management, and around immune building, and other things that cannabis was sitting on a pharmacy shelf for. um,
Yeah.
so when cannabis marijuana started to really make its explosion into the idea of becoming legal, and Colorado and several other states leading the way, um, there 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 was big discussions around the medical use for it, typically around pain management, cancer patients that were dealing with, chemotherapy, and nausea, and the difficulties of sleeping, or pain management even from that, glaucoma, and so on. That really reopened up the floodgates of, really looking under the hood on why actually cannabis performs. And they started to do more and more research and studies around it. the endocannabinoid system is actually the first receptor system that is developed in your body. Your body actually makes a natural connection to the enzymes that the hemp plant, the cannabis plant produces in these profiles. So you have a natural connection to it. Um, and there's a tremendous amount more of information and data behind this question that is available. Um, you know, from the early years of the night, even the 1900s, up into the 1920s, where cannabis was used a lot in medical practice. So there is information around it, but I think it's just because there was a tremendous amount of years of restriction and let's say turning the blind eye to it, that kept it out of your reach, that kept it out of your sight. And now, because of the explosion, it's like, where did all this come from? Well, it's actually all been there. They just haven't released it, or you haven't had the visibility.
Yeah. Well, it's certainly an interesting time to get more data on a lot of different therapies that are out there, and I think we'll only learn more as it comes. Chris, do you have anything you want to close with before we wrap up? I have a couple things to add, but I wanted to give you the floor first since you were kind enough to take time out to join us tonight and share some knowledge. Really appreciate that.
I appreciate you. I appreciate you as our partner, as a friend. You've been wonderful from the very beginning. You've supported not only Imbue, but me and how this relationship started. So I thank you for putting this together, obviously having me out last year. I look forward to coming back out again when we can get back to a little bit more normal society again.
Yeah.
But we really appreciate you, Brad, and all of your staff, and everything that you guys are doing for us on a daily basis. You've been a great support. And I look forward to doing many more topics with you over the coming months. I think LDN CBD will be an exciting one. We can talk a little bit more too about individual ailments and how CBD can help support those, and just continue to educate and be partners in making a difference. So we really appreciate you. Thank you for having me.
Well, thank you, Chris. And before the program got started tonight, we were talking about how to offer a discount to patients that were tuning in tonight. I think what we're going to do is expand it beyond what we were going to. And what we're going to do is we're going to offer 20% off the Imbue product label in our pharmacies through the end of the week. So that'll be through Friday. We got a couple options. If you're in the community in Canton, Louisville, Minerva, New Philadelphia, you're welcome to stop in the pharmacy. We are open. If you prefer, you can come to the drive up or request curbside service, whatever works for you. And we can take 20% off your order. Just mention that you listened to the webinar. And we also push this out on Facebook, and it looks like we're getting some questions that are coming over from there. I'll address those after the program. But if you'd like to contact me and have something shipped to you, you can either contact me through our Facebook pages, or you can use the email that you're going to get after this program and reply to that, and I'd be happy to take care of you. So you can just give me a phone number and we'll work with you that way. So I hope that you found value in this. If you have follow-up questions or topics that you'd like to learn more about, please, by all means, add them to the comments in the Facebook posts or on the website. And we're looking for more content to try to have 1 or 2 at minimum webinars a month on subjects like this. A lot of people asking questions about fibromyalgia and arthritis and pain and all those frustrating things that you just can't seem to get results with. So if you have subjects and questions, please post them up. And Chris, until next time, thank you very much. Be well. And
Thank you, you too, Brad.
thank you everyone for tuning in tonight. And we appreciate you and your questions and comments.
Thank you, everyone. Bye-bye.
Thank you.